Yes. Yes, this is our card. This is a card for doctors. Yes. You can go through this. You're already prepared. Just go through it for 30 seconds at least. Dr. Sholeh Toobaei. Yes.
Okay, shall I
One,
start?
1 second. Yes. So you can start now.
Okay, good morning. My name is Sholeh. I am the in charge doctor today. And may I know your name and age for verification?
My name is Abraham Lincoln and I am 63 years old.
Okay, I see. And would you please tell me what is the reason you came here today?
Yeah, doctor, I am actually in good health. I enjoy fresh air and sunshine.
Very good.
Actually, I don't visit a doctor because I'm almost always perfect in health. I maintain it that way. But 6 days back, I had a problem. I was digging in the garden, and unfortunately, a rusty nail went through my rubber sandal and slightly penetrated my sole, my right foot.
I see.
And I cleaned the wound with antiseptic and covered it with this dressing. But the thing is, it hurts still. Yesterday, I read in a newspaper about 50 people above 50 getting they have to get tetanus from simple wounds like that. So I got little scared.
Understand. I can understand your concern. Before going through the more further evaluation, I ask you, I have some question regarding your symptom. Do you have any muscle stiffness or spasm in your neck or throat or face?
Frankly speaking, I don't have any symptoms, doctor. I don't have anything of that sort, any pain or swelling or anything. But yeah, slight tenderness around the wound. That's a little tender. I feel that something like a soft. And I want to ask, is tetanus a serious condition?
Yes, I have to say that the seriousness of the disease is because it affects nervous system and muscles. That's why it is serious. But the good news is that you don't have any symptoms of tetanus. Now you don't better not to be worried about that. And I think the good thing that the best thing that you could do was consultation that you did. And I am happy that you did consultation regarding the tetanus and your concern.
Doctor,
Mhm.
yeah, I want to know if I really need a tetanus vaccination. I had one when I was a child.
Mhm. It's very important because it depends on the gap between two different vaccination. If it is more than 10 years, you need another vaccination. And it seems that it is more than 10 years, so I recommend you to do another vaccination. And this booster is needed. And
Okay, doctor. And
mm,
was the article exaggerating? It told a lot of information it gave regarding tetanus vaccination. So, didn't the vaccination I had, yeah, give permanent immunization? Is it not once for all? Should I take it again and again?
you have to, not you only, everybody should have a vaccination for every 10 years. And they should do another booster every 10 years um, after the last vaccination. But for you, because it is more than 10 years, you have to do another vaccination. Yes.
Um, is it safe for me to continue gardening at this age? I'm just 63. I can feel that. Gardening gives me some happiness, some pleasure.
Yes.
But because of this incident, I get a doubt. Can I continue gardening or?
I understand your concern. Outdoor exercise is the best type of hobbies that people can have, and gardening is very, as you said, it's very enjoyable. So I recommend to continue gardening, but it's better to wear some shoes or footwear that prevent this type of injuries. And this type of shoes should be very strong and covering the whole feet with thick soles to avoid the future injuries. Um, is that clear for you?
Yeah, thank you very much for your valuable suggestions. Is there anything else that I need to know, doctor?
I'll no in this step unless you have another question. Do you have another question? Any
No,
question?
doctor, that's fine. Everything is clear from my side. Thank you once again.
Thank you so much. Thank you for coming here.
Yes, Dr. Sholeh.
Yeah.
Can you give a brief introduction about yourself, your name, your profession, where you are originally from, and where you are working, or whatever you want to tell? You can give a brief introduction so that our friends may understand. So how we are, and give the feedback, how you are benefiting from these sessions, so why you like our sessions, what you are gaining from these sessions.
I like this session because you guide me very well, and I understand my weakness, and the point that you say is very helpful, and I try to follow your guidance and advice to be better in this speaking or reading. The session that we had for reading, it was very helpful, and I like to have another session for listening because I have a weakness in that area as well. In general, I think that it is very helpful. And if somebody asks me about your sessions, I definitely recommend them to come to your class.
Yeah, as a professional, medical professional, you practice medicine. So,
Mm.
what are the areas which you feel difficult? and reading or listening or writing or speaking, what's the most difficult according to the priority? You can tell one or two which you feel the most difficult.
I think the most difficult part is listening, part A. And the problem is that I am not so fast, and sometimes I miss the next question. When I'm writing the first question, I miss the second one, and then I lost the track. I lose the track, and the other part that I can say that is my weakness is about part B, reading, and also
Okay.
listening. Also listening.
Okay. So that's really good. And now you can introduce yourself, your name, your profession, your designation, and where you're working, where you come from, and how did you come to know about our classes?
I come from Iran. I am Iranian, but I live in Dubai. I am a psychiatrist, and I work for more than 10 years in this field. And I understood from your class, from WhatsApp group and in Telegram.
Right. So now let me give her feedback for you. Dr. Sholeh Toobaei from Dubai, United Arab Emirates, and she's originally from Iran. I have trained some Iranian doctors earlier. Fine, that's very good. She's a doctor by profession and she's preparing for the exam. She did not book the exam yet, and she first prepare and then she will book. That's so wise of her. So she's wants to be confident first before booking the exam. That's really great. Right now, coming to the point regarding this speaking session, it's tetanus, tetanus vaccination. Tetanus vaccination is the topic. And introduction. Yeah, introduction was fine, but I cannot tell you that it's up to the mark. You have to improvise in that area because the first time when you're interacting with somebody, you have to create an impact on the other person that from the beginning to the end, he will be glued. Eyes will be glued on you. So, and his mind will be fixed on you like that. You have to create an impression. That's a very important. The first blow should be a hard blow. Hello, don't use the word. Hi, don't use the word. Because you did not use, of course, but I'm just telling everyone who is watching this video. So these are informal styles. Hello, hi, hey, or whatever. These are informal styles. You can talk in general, casually, but not formally or official meetings. You cannot do so. Then what should you do? You can say good morning, good afternoon, good evening, or good night, or whatever, good day. The next one, you can say, I am, yeah, please come on and have your seat. And I am, let me introduce myself to you. I am Dr. Sholeh Toobaei, and I am your visiting doctor, or I'm your treating doctor today at this medical hospital or clinic, whatever. So, and I am pleased to attend you. And now, can you please introduce yourself to me? I need some basic information such as your name, age, and the purpose of your visit. And so this is the way how you can speak. Whatever I'm telling you, it's already on the YouTube. You need not note down. Afterwards, you can relaxedly watch the YouTube. It's there on your name. You just type a Sholeh Toobaei and your name on the YouTube. It's written correctly. So you can just get it from the YouTube. Just type your name on the YouTube and you'll get it. And okay, you can also type Sholeh and what's the name? Tetanus, Sholeh tetanus. Then you'll get this. If something else is there, Sholeh and that name, that case, what's the problem that you write, and it will come directly without any problem. Directly your video will come. So you can listen to it and you can carefully note down all the points because in this hurry, you need not waste your time because you have to focus on what I'm telling now. Don't write anything now. Then coming to the point, grammar. Grammar is good. I can say better, but not the best. I mean, the quality. Your grammar is almost 90, 85 to 90% correct. But I mean, whatever you're speaking, that's perfect. No doubt regarding that. But what about the quality? Quality is not high grade quality. It's a mediocre, average grade quality. That means I appreciate your way of speaking. I told, shall I continue with this gardening or should I stop? Then you said, yeah, that's fine. You can continue with your garden, but take care of your feet. Use some good shoes. Take all the precaution. So you have, okay, you have discussed all these things, but you can join these two sentences. Undeniably or irrefutably, undoubtedly, you can continue the practice of gardening without any confusion, without any doubt, without, so undeniable, without any doubt is already told. So there is no need to worry. But remember, your health is your fundamental priority. And therefore, you need to take all the precautions. Okay? So that you will not be hurt in the process. Gardening is good. But while doing gardening, why should you get hurt? Prevention is better than cure. Because you hurt your foot, you hurt your soul. So you are now in confusion and you have reached me. You're suffering in one way or the other. So better prevent yourself from such injuries rather than suffer later. See the way how I am speaking. All these sentences you could have spoken. The power of language is very important. You can create a great impact on the listener. So that's very, very important. This is grammar, which is quality, qualitative, quintessential quality, I say. Try to infuse, try to build extraordinary sentences which this listener will be looking at you, awestruck, or you can say just dropping, spellbound. Should create a great everlasting impression on the wow. The person who is going to attend your interview after finishing his day, when he meets his colleagues in the evening, in the bus, when they're transporting themselves back home, they should tell your name. I had a wonderful candidate. Her name is Sholeh Toobaei. She's from Iran. What a wonderful sentence she has spoken. What a quality she had in her speaking. I was really stupefied by her vocabulary, her grammar, her sentence structure. That's what she has to say. That means you're going to get A grade. You have that in you. You can do it. But practice is important. The next one, vocabulary. Yeah, vocabulary. You have to improvise in vocabulary also. And at the same time, pronunciation. Yeah, pronunciation is okay. You cannot be a native speaker, but definitely you can be a near native speaker because you are a graduate. I do not know whether you're a postgraduate. You said you're from psychiatry department. That's good. But there are some areas which you are concerned, you have to be concerned about in your pronunciation. That's you are making some unnecessary sounds. Uh, 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 like that. These are meaningful gibberish utterances. They don't value anything at all. Avoid them as far as possible. When I'm speaking, am I doing those sounds? Am I ringing those sounds in my speaking session? No, definitely not. That means I'm quite confident. But you're not so confident. Try to gain confidence. How will you gain confidence? The speaking parts, the speaking time for you is very less. Maybe you'll speak maybe 10 to 20 sentences every day. That's all. You're not speaking at least for 30 minutes every day. If you speak 30 minutes every day, then you will definitely have quality in your speaking. You're saying uh, like that. Avoid these things at any cost. Pauses and breaks. This is a meaningful pause. This is a meaningful break. Because I'm trying to give an impact. I'm making you ready for the next sentence. I'm giving a pause of 1 or 2 seconds every sentence finishes. Because you should be ready for the next sentence. You should understand what I spoke earlier, and you should be, because you told me earlier, I am not very fast. That's it. There are many people who are not very fast. So for them to understand and grasp the intent and the content of what you're speaking is very important. Give them a chance to understand what you're speaking. Then you can restart. So these are pauses and breaks useful for. But your pauses and breaks are not very fine. They have a negative connotation. You're pausing and you're breaking because you do not know what to speak, and you're thinking, analyzing what should I speak next, like that. It's very evident and clear that you are building your thought process. So that's the problem. The next thing is accuracy. Accuracy is 100%. But accuracy should be 200% or 300%. What is this 200%, 300% accuracy? Accuracy with regard to quality of grammar, accuracy with regarding to vocabulary, accuracy with regarding to pronunciation. So now let me tell you grammar, accuracy regarding grammar. You are right. You are right. It's accurate. Then how can we improve it to 200%? Absolutely excellent. You are absolutely, your concern is undeniably reasonable. Your doubts, your concerns, your questions are extremely important. You are right. Instead of that, your concerns are extremely reasonable, quite appropriate. So how to improvise your quality is important. You're 100% right, but still you can improvise the quality. That's what I'm telling you. The next one is vocabulary. Okay, good, right, perfect, perfect. Instead of saying good, perfect. Sounds reasonable. Just 2 words. Sounds reasonable. That sounds reasonable. 3 words. Reasonable. Perfect. Excellent. I do agree. I'm with you. No doubt. Undoubtedly. You can use many, many different words. Is that clear, Toobaei? Yeah, now next time. Flow of thought. You have a problem with your flow of thought. Your ideas, your words, your vocabulary, your sentences are not coming spontaneously. They need time, at least 2 or 3 seconds to process. This is because you are not a regular speaker of English language. So practice regularly. The next one, sentence construction. Yeah, development of plot. You're very good. You're a genius, I can say, regarding development of plot. I understood by that answer, multifaceted answer. I told you, should I stop gardening? You said, no need to stop gardening. You can continue by all means. And you did not stop. You did not stop. You went further and said, but mind you, take some precautionary measures. And you went extend further and you explain what I should do. A tough leather, good sole, nice shoes, well covered, prevent from let all these things you have definitely explained me. That's the best part of your speaking. You have done a good job. You have grace and charm in your speaking styles. I really appreciate. Why not then everything else? Right. Now I am giving you 1 minute to speak. Yeah, the time is all yours. The stage is yours.
1 minute to speaks about what?
You give your feedback, what you learned, how beneficial this session was. Your speaking session was something 5 to 7 minutes, but my speaking was 10 to 12 minutes. I gave you
Yes,
a
yes.
detailed explanation, more than what you use for speaking role play. Yeah, tell me.
Yes, I think that what you your point is very helpful. I have to work on them, especially flow of thought and fluency, and to be fast and more spontaneous. And this is coming only by practice. I have to practice every day for, as you mentioned, 30 minutes at least every day speaking, and try to think multi facet, I mean language, as you mentioned, that different paraphrase or use another vocabulary, high level sentence, and increase my vocabulary and try to be correct. And in terms of grammar, and reduce pause and break. And this is what I understood about my weakness. And I appreciate that you mentioned all my weakness to work on them.
Yeah, one last point is, do you think I'm very harsh and rude, or you think you deserve this quality feedback? What do you think? Should I reduce this one, or should I be strong like
No,
this only?
I think that you are absolutely correct, and I like to be feedbacked to see what is my weakness and to work on it. I don't want to be just say it's okay and continue in the same way and repeat my mistake again and again.
Yeah, when you say repeat, you should not say again.
Uh-huh.
Repeat means say again. Again is already there in the word repeat.
Yes.
So repeat the mistakes multiple times, or
Yes.
make mistakes again and again. When you say again, again, you need not say repeat. When you say
Mhm.
repeat, you need not say again and again. They are synonymous.
Repeat
Repeat
mistake
itself has the
multiple.
word again. So there
Yes.
is a mistake. That's a mistake. You understand now? We don't know that we are doing mistakes. That's the problem. Yeah, that's fine now. I'm going for my lunch. Have a nice day. I'll give
Thank
you
you so
another
much.
speaking session later, I think.
Thank you.
Okay.
Appreciate.
All right. Thank you very much. Have a
Thank you
nice
so
day. Bye
much.
bye.
Thank you. Have a nice day. Thank you. Bye bye.